This time managed to avoid another crisis and pass a budget to fund the government for the next couple of years. Congresswoman Shea-Porter voted in favor of that spending plan. She's here now to discuss why, among other things. Congresswoman, good morning. Happy holidays. Good to see you.
Thank you.
So let's start with the budget. And does it strike you as sad that so many people are like, wow, Congress actually did something, got something done, they came together?
Of course it does. And I'm not thinking that this is the greatest budget we could have produced either. It was a hard compromise, but the reality is that's what the American people want us to do. They want us to compromise, but it was a tough one.
Imagine for you it had to have been difficult given the fact, I mean, you've always been in the corner of a lot of veterans, but one of the critiques about this budget was how it affects the pensions of military retirees. Kelly Ayotte voted against it because of that issue. Why did you vote in favor despite of that issue?
Well, first let me point out that John McCain voted for it also, so it wasn't whether you supported the veterans or not. There isn't anybody who's a greater supporter than John McCain, and I am
So explain it.
Right, I will, and I was a military spouse, so very proud of that. I knew that this was the vehicle that I was presented with. We had plenty to say about it, but this is what we were given. And so we would do even greater harm if we didn't do that. We'd do greater harm to the military, we'd do greater harm to veterans programs, we'd do greater harm to Head Start and to our shipyard and to our National Guard. So I knew that we'd come back to it. This is politically so unpopular, and you really have to look at something and say, will this fly, or will they bring it back and tweak it? And I was pretty certain they'd bring it back and tweak it, and that's exactly what they're going to do. And I'm part of legislation to do that.
When you talk about tweak it, you mean because it's $6.5 billion. So there's still adjustments to be made within the framework of this budget.
Absolutely. You know, what people need to know is there wasn't one penny taken away from subsidies for corporations. We asked nothing from corporations. We didn't touch oil subsidies. If we'd done any of those, I mean, we never should have said, okay, we're going to go after military retirees' cost of living allowances until the age of 62. We shouldn't have done that. But I knew that politically and morally that wouldn't fly. And you hear people all around the country saying that's not right. So we will fix that. And I hope that we will look for that money somewhere else, in a place where it is. You know, we have corporations that pay zero federal income tax, corporations like Facebook. They pay nothing. So who thinks that we should ask our military retirees to do that before we ask profitable corporation pay something in federal income tax? So I knew it would be fixed.
Yeah, so let me ask you, I mean, even those who voted in favor of this bill, I haven't heard one person say, you know what, this is a great budget.
No.
So in your mind, how much was it about, you know, collectively the thinking in Washington, let's get something done, let's show American people that we can pass a budget, that we can keep the federal government open, and then we'll go back and adjust,
right,
you know, the fixes that you're talking about. How much was it about that?
Well, a lot was about that, clearly. You know, I think most Democrats, one of the terrible things about this budget, in addition to that, is that we didn't extend unemployment benefits for people who can't find work. And we know right now there are 3 people for every 1 job on the market. What do we say to the other 2 right now? So that was wrong also. I mean, there were a number of provisions there that were just wrong. But the reality is that this Congress thinks very small. And so, you know, we have to work with who's there.
What do you mean?
Well, we haven't passed a jobs bill. We really haven't done anything at all. We're going down as the worst Congress since, well, I think forever.
Unproductive.
That's right, very unproductive. Things very small. We take way too many days off. I just want to say that I don't set the schedule, and I think that we should be there longer, and I think we should address the problems that the American public wants us to address. Jobs.
You sound a little frustrated.
The economy. Well, of course. It's embarrassing. You know, I keep saying we shouldn't go home. We should stay on the job. We should get this work done. We should do what the American public sent us to do.
So let me ask you, looking back over the course of the year, let's talk about all the way to the top. How would you grade out the president's performance in year 5 of his presidency?
Well, I've been very unhappy about the rollout. You know, I think he's done other things well, but that clearly was not one of them. I share the frustration and the anger that others feel as well. But if you look across the spectrum, you know, it's mixed. I would say a B. Maybe a B minus.
Okay, a B minus. Now let's talk a little bit about that rollout. Were you surprised? Were you shocked when immediately from the website to the exchanges, some of the problems that started happening right away, and sit back and say, how did this happen?
Yes. Yes, like everybody else, and I don't accept any excuses. I spoke to the president, I spoke to Kathleen Sebelius, I've spoken to everybody up and down the chain there, and I don't accept any excuses.
So heading into 2014, I think it's fair to say that Republicans will likely put a lot of focus on the Affordable Care Act. I'm going to say something to you that you're likely going to hear a lot next year. If you like your doctor, you can keep your doctor. You said it, the president said it, a lot of people who supported this bill said it. It's not necessarily the case.
Well, like I said, I'm angry and frustrated, and what we should have known is that insurance companies would act like insurance companies because they could have just added the provisions there. But the reality is that we've already taken care of it for this year. I worked with Anthem. The problem is that people aren't working together on this. You know, you see repeated votes to repeal it. You see the trouble that we had in the State House. You see the problems that we had on the federal level. And so we need to work together to improve this. We can't go back to the way it was. Think about where we were before we had a health care law. We had no consumer provisions to protect us from insurance companies.
A lot of people might tell you, though, Congresswoman, that, you know what, at least individually, I was better, and I'm not saying myself, but some people will say I was paying less, my coverage might have been better. Maybe collectively the industry wasn't, and it was cutting into the GDP more than it should. But it's going to be a tough sell to people who are paying more than they were before. Well,
one of the good things that we're seeing right now is that the health care costs, the increase in health care costs has actually slowed down. And so we've put a lot of provisions in there. And people know that they can keep their kids on the policy to the age of 26, which is important. They know they can't be kicked off a policy anymore because, you know, the insurance company discovered they had acne just before they need major cancer surgery. People won't have a medical bankruptcy. There's no caps to say if you're sick longer than the insurance company wanted you to be ill, that they can't throw you off the policy anymore. So there's a lot of really good provisions there. I think one of the most important ones is that insurance companies used to be able to charge whatever they wanted. They had no accountability, basically. And now we've said that 80% of the premium has to go into the medical care. There's also preventive care. There's benefits in there for seniors. So there's a lot that we fixed in 2010, and now there's a lot we need to fix now.
I want to point out that the benefits that you were talking about, those were implemented immediately after the passage of the bill. We're talking about, you know, the kids being able to stay on their parents' policies, the closing of the donut hole, pre-existing conditions. Problems really started to emerge with these exchanges. Do you think the exchanges are a good thing? I mean, here in New Hampshire, for instance, it's not even an exchange. There's one carrier. I mean, there's no competition.
It's outrageous, isn't it?
So if you could go back and undo that portion, what do you think the likelihood is that we see that go away?
Well, there's going to be more insurance competition in 2015. We know that Minuteman is coming, and they're a co-op, and they should drive costs down. And there's another one that's, I think, very close to announcing. So that's three that I'm aware of. And the public option would have served that purpose to provide that competition alongside. And Anthem is now a monopoly. And trust me, I have had plenty to say to Anthem. One of the things they did was, you know, there are 26 hospitals in the state of New Hampshire, and they narrowed their network. And I'm furious about that. There's no reason to do that. I have spoken to them repeatedly. I've spoken to the White House. I've spoken to Health and Human Services. I've spoken to Center for Medicare and Medicaid Services. You know, this is just not right.
Sure.
So,
and you have a Frisbee Hospital president who's out there as loudly as he could possibly be saying, hold on a second, we've been serving community, you know, low-income community for a long time, and suddenly we're cut out and weren't even asked about it. Do you think that Anthem needs to come back to the table?
He's right, and Frisbee's right, because they would have accepted the rate that Anthem was offering. Okay. And so the network is too narrow. So, you know, that's my next job, and I've been working on that, and, you know, Anthem didn't have to do that, and they shouldn't have done it.
Heading into an election year, how big of a deal do you think this is all going to wind up being for Democrats like yourself?
Well, I think it's something that we should talk about and say we need to keep improving it. You know, we had problems in our state house, so we wound up with a state-federal exchange because at the time